and the solutions. Okay, so so as you all know, the MRCS exam stands for it's a UK-based degree. The MRCS itself stands for Member of Royal College of Surgeons. It has two parts, Part A and Part B. Once you finish your Part B exam, you will be issued a diploma from the Royal College. So it's an intercollegiate exam. There are 4 colleges that offer this diploma for you, but the exam is the same for all colleges. They conduct only one exam. There will be one paper. Those colleges are Royal College of Surgeons, England, Ireland, Glasgow, and Edinburgh. I myself did the exam from the Royal College of Edinburgh. So this exam has 2 parts, as I said, Part A and Part B. Today we're going to focus on the Part A exam. It's a theory exam that tests your fundamental knowledge of the surgical topics and the basic sciences. The purpose of the exam is the assessment of your core knowledge, and the benefits that this degree and this exams provide for you is it increases the progression of your career. Once you have your MRCS degree, you can apply for the GMC registration, which is most of the people's purpose for this exam. You can apply for the GMC registration, and I have known a lot of people that are in the UK from this route. Secondly, the MRCS exam prepares you for other advanced exams like FRCS. And the other benefit of this exam is once you get your MRCS degree, although it doesn't allows you to practice surgery with the MRCS exam, with the MRCS degree, but it offers a certain bit of advantage for you. It increases the value of your CV or resume, and if you in the future try to go to other countries like Gulf or any other place, this degree will offer a little bit more of advantage in terms of salary. So we covered this portion, and let's talk about the format of the exam. The MRCS Part A exam, as I told you, it's a theory exam. It has 300 questions divided in 2 parts. The first part is the applied basic sciences. Now, the applied basic sciences has 180 questions, and the other part of the exam is the principles of surgery in general. It has 120 questions. The combined total is 300 questions, and they are both conducted on the same day. So you will have to go through the applied basic sciences. The format will be you will have 90 minutes to go through 90 questions. Then you will have 10 minutes break, and the other 90 questions will be after that. Then when the first paper is over, you will be offered 30 minutes of break, and the other paper will start only after that. There will be no break in the paper 2. 120 questions, you have to tackle that in 2 hours. So on the day of the exam, you have to be energetic to give this exam in 5 hours, you know? Okay. We're done this. Okay. So the topics will be anatomy, physiology, pathology, microbiology, and pharmacology for the paper 1. For the paper 2, it is the principles of general surgery, which include general surgery, orthopedic surgery, neurosurgery, endocrinology, and peds surgery, along with surgical pathology. So you have to be prepared to be tested on all those parts. I think my screen is not full. Let me just see what's going on. Okay. Okay, so this is the two papers and the content. The syllabus, as I told you, is anatomy, physiology, pathology, microbiology, and pharmacology for paper one, and the principles of surgery and all those orthopedic, neurosurgery, peds surgery, and endocrinology for the paper two. You will be tested on those subjects. Just to see how the MRCS questions will be. I know all of you are familiar with the pattern, but let's just see how the questions are. So this is a question for the MRCS Part A exam. A 40-year-old male undergoes a midline laparotomy. During the procedure, the consultant points out the most superficial layer as fatty. Which of the following is likely being described? Can anyone tell me the correct answer?
Camper's question.
Yes, you're right. So Camper's fascia. So as you can see that it's a scenario-based question. You will get multiple answers, but you'll have to choose the best single option. Why am I saying that is because not in this question, but most of the questions that you will get during the exam will have at least one or sometimes even two or three right answer. So you have to choose the best answer. Like let's say, for example, you're coming across a question and you see that two options are correct. Which one to choose? So you have to be very careful in that scenario. Okay. So yes. So the strategies on how to prepare for the MRCS exam. Well, most of the people, I'm sure you have talked to a lot of your colleagues, your seniors, on how to tackle the exam, and everyone will say a different version of things. Some people will tell you to go through textbooks. Some people will tell you to go through question banks. Some people will tell you to go and do past papers. But the problem is that everyone will guide you according to their own experience. That's why you need a very comprehensive study course. Uh, I will suggest that you have to do textbooks at least once. Now, why I'm saying that, when I gave the exam, most of the questions were changed. They were new questions. So the passing rate at that particular attempt was very low. Now, people that did the MCQs or the question banks, they were complaining that we have to email the Royal College and this and that, but nothing will happen. You have to be prepared for all sort of scenarios. So that's why you have to at least do the textbooks once. I'm sure every one of you has done these during their medical college, so it won't be hard for you. So we have recommended Gray's Anatomy for students. Now, the reason for that, I'm saying Gray's Anatomy because it has very illustrated pictures. You won't need an atlas along with Gray's Anatomy. But Snell is also good. I did Snell, mini Snell during my preparation, but I had to use Netter Atlas with it. The other book that's really necessary for the applied basic sciences especially is the basic sciences for MRCS. There's an alternative to this. We call it Raft Tray. That's also very famous. So for the surgery principles, there are few books, the best of which is Bailey and Love. I'm sure you have gone through Bailey and Love multiple times during your medical school. So have I. So you won't have any problem reviewing Bailey and Love. You don't have to go into very much details of Bailey, but you have to do the revision of the Bailey and Love. That will be enough. Now, because it has a very, I know you have gotten the idea how vast the course and how vast the syllabus is. Now you need a very smart and concise study plan for this. Uh, a study plan helps you with a comprehensive coverage. You see, anatomy, physiology, pathology, these topics are basically the whole of the MBBS exam, excluding medical specialties. So, as you can see, 5 years of knowledge will be crammed into one exam. You have to have very comprehensive coverage for that, and that's why a study plan is really necessary. The second thing that a study plans helps you with is time management. I'm sure, like me, most of you are working in hospitals, being a medical officer or a resident surgeon, or even some of you may be in internships. So I can understand that time management is a very, very serious issue. So you have to have a steady plan to cover for your time management. We will make you suggestion or a plan for the time management as well, so you don't feel overwhelmed along that. Thirdly, the consistency. A steady plan helps you develop habits. Like if you're consistent with your studying, let's say, for example, 3 hours daily, 2 hours daily, 4 hours daily, it will give you habit of studying every day. And what does that do? It increases your confidence. It increases the calmness and the control over your uh, preparation. It also reduces your stress. So if you're going through a lot of things in a short period of time, you have to have a steady plan. And obviously, the very necessary thing for the study plan is also self-assessment. When you're done with a specific topic, you have to have a self-assessment, and let's say in form of MCQs or talking to a friend or anything. But you have to have a self-assessment. That's really, really necessary. Okay, so how do we, now that we talked about the importance of a study plan, let's say the techniques, let's talk about the techniques of how to uh, execute those study plans, how to make a study plan. So first of all, you have to understand the syllabus. Now that we know the syllabus, you can divide your syllabus into small manageable parts. Let's say I'm dividing my syllabus into anatomy, physiology. Now, the anatomy part I'm dividing into upper limb, lower limb, thorax, abdomen, pelvis, head and neck, and this. So you have to understand the syllabus. You have to divide it into manageable and doable parts. So in one single day, you can only, let's say, for example, in a single day, you can do upper limb. You can do all anatomy. So this is a very important thing. The second thing is you have to set a timeline. So most of the people will think, okay, uh, I have booked the exam. I'll start studying today, tomorrow, today, tomorrow. This will this is a very, very bad thing. It destroys your whole preparation. You have to have a timeline for your study. Let's say, for example, I want to give the MRCS exam in January. I have 5 months or 6 months, let's say, 6 months of studying. I have to devise a plan that I will finish my course in 3 months, and the other 3 months I will do for revision. And of those revision 3 months, I will do question banks in this much time, past papers in this much time, and this and that. This is really important. The third thing is the daily or weekly goals. You have to have goals. For example, let's say I'm doing physiology. My goal for today is to do the physiology of respiratory system, you see. And after uh, the topic is done, I have to go through the questions. So you have to have specific goals for a specific time period. The other thing is, obviously, I talked about the incorporation of practice questions. After every topic, you have to have a practice test of yourself. You can do self studies, you can do with a friend, but we encourage you to do it in a group. So you can, if there is any specific suggestion from anyone else, you can also benefit from that. Most of the people are good with a portion of the study. Let's say, for example, I am becoming a neurosurgeon. So for me, the neuroanatomy, the skull-based anatomy, it's easier. So if I am giving the exam, I will set that aside for the later period of time. What I'm lacking, let's say, for example, for me, pathology was difficult. So I had to do pathology first. The benefit of this is that when you're doing a harder topic first, it will give you time to revise that again and again and again. So you will be grasping that better. And obviously, you have to use a lot of sources, a mixture of sources. The books, question banks, visual aids like videos. You can have discussion group with your friends and with your colleagues, and so on and so forth. You get the idea. By flexibility, we mean that obviously things not always go as planned. Let's say I plan to finish the course in 2 months, but unfortunately, due to any reason, due to any unforeseen circumstances, the preparation lacks and it's going really slow. So I have to be ready for that. So when you're devising your plan, when you're making your plan, you have to be ready for this possibility as well. Once your preparation is done, once you're finished with the syllabus, you have to do a mock test. And there are mock tests available. The eMed Masters will also provide you with mock tests. So you have to do those. The benefit of mock tests are a few things. So first of all, when you're done with the syllabus, you do a mock test. It gives you information, an idea on which parts are you lacking. When I did my first mock test, I found out that I was lacking at orthopedic surgery. And it was really important. I will tell you why. The second thing is that it gives you an idea of the exam day. So 5 hours of sitting in a exam room is really stressful. If you have done the mock tests, then you will be more in control of things. You will be more calm. So these are the benefits of the mock test. I'm sure you're all got the point. Okay, so where was I? Okay. So here we are. Obviously, the MRCS party exam test does not test only your knowledge, but also your ability to apply the knowledge in clinical scenarios, regular practice. Obviously, you know this. Now, the issues faced during the preparation, time management issues, we talked about this. The doctors have very busy schedule. So you have to have a devised time for your study. You have to manage your own time according to your specific routine. If you're working in the morning or in the evening, everyone has a different circumstances. So you have to have a specific time set for your studies during the day, and you have to study every day for this exam. The other thing that you will face during the preparation is that you will notice that you forget things. You don't have the ability to retain information for a very long period of time, and this happens because the syllabus is very vast. So repetition is the key here. You have to repeat again and again and again. The other thing that helps is that once you finish a topic, let's say, for example, you're finishing anatomy of pelvis, and this week you have done the anatomy of pelvis and abdomen, and next week you're starting with the anatomy of head and neck. Before you start the anatomy of head and neck, go through the questions of the pelvis and abdomen part, give it a quick revision, and then move on to other part of the syllabus. So this also helps with the motivation. If you're doing well with the self-assessments, it will keep you motivated. To avoid burnouts, I will suggest that you have to have some breaks in between. You have to have your own entertainment. Everyone has their own. So this is really important. You don't want to get overwhelmed with the course. So you have to have some sort of break in between your studies. By poor exam technique, you mean that I will give an example. So one of my colleagues, he also was preparing for the MRCS. So when we went to the exam hall on the day of the exam, the questions were all scenario based, and unfortunately, the time was finished, and he was only done with half of the questions. So you have to have an idea of the time, you have to have an idea of the question, and you will have to practice the questions that are coming on the exam. You have to practice it with the question bank and with the mock exams. It will give you an idea on how to tackle the exam, because most of the scenarios will be 3, 4, or even 5 to 6 lines. So when you're done, when you're just reading the scenario, the time will finish on that question. So you have to be prepared for this as well. Anxiety and pressure exam, obviously every exam has its pressure, every exam has its anxiety, but if you're doing the steps that we have told you, this will be very easy for you guys. Lack of understanding of core concepts, this can happen with a lot of people. Not everyone has to not everyone has the capacity to learn everything at once. So there are some high yield material that we will provide you along the course, that you have to go through those to have a better understanding of the concepts of the syllabus. Okay. Obviously, I also discussed the solutions along with the problems with you. Structured study plan helps you retain the knowledge that you have gained through your study plan. It helps you manage your time. It helps you be consistent. You have to use high yield sources that we will provide you during this course. And active learning is obviously you have to apply those things that you have learned on your daily practices and your daily exams. So we talked about the mock test and self-assessment as well. And the study groups are really important, guys. So you have to have study groups. Without the study groups, this test can be very much overwhelmed. It can be very much stressful. You have to have a support group. You have to have a study group. It can happen without that. So, is there any questions? Let's hear it. Any questions? Yes, sure. Go ahead. What's your question? Mm-hmm. So Shazia is asking me, please suggest any course where to get study material. Well, There are a lot of courses out there, but I would suggest that you should take the course that we provide you here at EMEDS. It will give you all the study material you need. It will give you the books. It will give you the mock tests. It will give you the question banks. Everything you need will be provided to you from here. Uh, okay. Tabassum Tanzil has asked me, from where do we get the mocks? We can provide you mock tests here. Once you're done with the preparation, we will give 1 to 2 mock tests. We can do 3 to 4 according to demand. Mock tests will be provided. Okay, so Dr. Ali Faraz has asked, what about the EMRCS subscription? Well, look, EMRCS is an online subscription. It has 2,000 plus questions. It's a very good source of study. If you can, you should go for it. But I would advise to study the textbooks as well. EMRCs can be provided to you by emails as well. We have EMRCs here, so we can provide you that. If you want to study EMRCs as a question bank, it cannot replace your study books, but it can be used as a question bank. We can provide you that, yes. EMRCS is an expensive option. Yeah, it can be expensive. That's why we are offering you the alternatives here. Dr. Ali Faraz has asked, suggest any good books. So, suggest any good books. So we can go with subscription and books too. Any books guidance. So the books I told you for the anatomy, you can use Gray or Snell, Mini Snell. You can have an atlas with you. You can use Raftray's book for applied basic sciences. You can use Bailey and Love. The problem with this exam is not all of the syllabuses is in one. So once you're done with these books, you can go for the questions as well, or even during the preparation, when you're done with one topic, you can go practice it on a question bank that we will provide you. Why does the college change sequence of question in every setting, especially paper 2? Well, that's kind of obvious, right? So when the candidates finish their exam, they leak the paper. That's simple as that. Like if I'm the candidate, I will discuss it with my friends that this question was out was on the test day. That's why they change it. They have to change it. Thank you, sir. No problem. It's my pleasure. Okay, I am also looking forward to work with you guys, and I'm sure all of you will ace your exam. The Shafiq has asked, the course you provide has got specific timings. We will go through that. Now, it was just an introductory webinar. The details of the course will be provided to you guys. You are all added on the WhatsApp and Facebook group, I suppose. So the details will be discussed there. So we have just a couple of minutes more. If you guys have any other question, please shoot. Which other material question bank can be used, especially for paper 2, as EMRCs is not as just paper 2? So listen, EMRC, as I told you, EMRCS is only 2,000 questions, and the paper 2 is almost changing. You have to have a book. You have to have a textbook to complement your question bank. Without that, the exam will be difficult. And the questions, if you're specifically talking about the questions, those we can provide you for the paper too. But you have to go through the book as well. Kindly provide us the course detail as soon as possible on WhatsApp group. Yeah, sure, we can do that. Okay, guys, I think time is up. If there is no more question, then I have to conclude the session. I think someone is trying to type something. Okay. Yeah. Actually, the details of the details of the emails are written here. You can see the contact number from my screen. There's also a Facebook group. Let me just it's right here. This is the contact number for emails, and this is the Facebook page name. You can contact us there. Okay. It was nice talking to you people. Have a nice day, and I hope you all pass your exam. And with the help of each other, we will inshallah do it. Thank you all. Bye. Have a nice day.